The best available evidence, which I will be the first to say is not particularly great, shows that this virus is probably going to slow down when it gets warmer. The best available evidence also says that that slowing down is not going to, in fact, slow it down enough to prevent rapid spread. And, it's sort of obvious. I mean, look at what's gone on in New Orleans or in Singapore, right? So clearly, it's not as though if we get a heat wave, this is just going to vanish, right? And so regardless of the climate, the virus is probably going to be able to spread based upon how immune the population is, how many people have been infected, how much we're congregating with each other, and how much, we're moving around. Like, those are big factors. Is the temperature going to matter? Absolutely. But I think it is a really not good idea to bank on that, especially since we know it obviously can transmit in very hot, muggy conditions in places around the world. And again, think about what I said a minute ago, which is that we know that when the temperature goes up in Boston, and Boston is particularly the canary in the coal mine for heat and climate change, because one, it's warming up in Boston faster than pretty much anywhere in the United States, save for Alaska. Two, our culture is not adapted to heat, right? So you go to the Deep South, people know you have to be in air conditioned, everything is air conditioned, da da da. And so we actually have some of the highest risks from heat on that basis. And so you can imagine a scenario in which we're like, we're not doing this. I'm very grateful to our governor and others who are in public health who have really seen that we are, I think, taking very appropriate measures to protect ourselves from this. But if we were loosening up, restrictions rapidly and we had a resurgence of COVID with a first summer heat wave, it could be a real mess in terms of our healthcare facilities and their capacity to deal with that.